Good evening, everyone, and thank you for joining us for another episode of Let's Talk About It with my co-host
Michelle Peterson.
and Felicia Hopkins. We are so glad to have you on today with us, and we're excited because it is the month of February, Michelle.
Mm-hmm.
Where has the time gone? We are already in the first week of February, and it just feels like it's still January.
Mm-hmm.
We want to make a couple of announcements before we get started with our special guest today. We are looking forward to celebrating Black History Month via some special clips. If you haven't already seen them, we're going to focus on health, minority health, and those that have made wonderful discoveries in the in Black history and in American history here from the Harford County Health Department's page.
Mm-hmm.
We also want to take some time to let you know that along with us celebrating Black history, we are also going to be focusing in on what we eat. We invited Chef Catherine Brown. She is a local chef here in Harford County, and we are going to have her at the village of Lakeview making healthy meals and teaching us how to eat well during these winter months using a crock pot.
Mm-hmm.
I know a lot of you have already registered, and we appreciate that. There is a flyer that's already posted on our page. You can look at the Harford County Health page and find more information about that. But we need you to register because if you do and participate, guess what? You will get a free crock pot from the Harford County Health Department. And who doesn't need an extra crock pot to make their special meals in and learn how to eat healthy?
Mm-hmm.
So, today, our topic is talking about heart health and cardiovascular health care. And in the minority community, it is very important that we not only know about ways to keep ourselves healthy, but talk to experts that look like us to be able to share with us better ways to take care of our health, our heart, and cardiovascular care. So, without further ado, we have invited a special guest. She is a nurse practitioner, Dr. Kaysen, to the show, and we're going to bring her on right now. Hello,
Good
Dr.
afternoon.
Geneva Kaysen. Good evening to you. We are so glad to have you, and we're just going to start out with a couple of. We just want to know more about you, what you do, and who you are.
Well, first, I would like to thank both of you for inviting me today. Again, my name is Geneva Kaysen. I'm a family and emergency room nurse practitioner. I've been practicing for about 10 years. I work at Upper Chesapeake Medical Center in their emergency department. I'm also adjunct faculty in the nursing department at Bowie State University and one of the directors for the Nurse Practitioner Association of Maryland. Most of my experience involves family medicine and emergency medicine.
Wonderful. We are so glad to have you.
Yes.
Um, it is so glad to see more familiar faces in the community that we can trust and go to for different questions and health needs. So we're just going to just make this kind of conversational, and we're just going to ask you a couple of questions, and we just want you just to answer the best that with the knowledge that you already have concerning heart health. So our first question we had was, what are the risk factors in women and men in regards to heart health?
There's several risk factors for heart disease, some which we can change, some of them we can't change. To begin with, eating unhealthy foods, obesity, and physical inactivity. These are risk factors that can be changed. Diets that are high in salt and sodium, they've been linked to increased weight gain, which leads to heart disease. Then we have smoking tobacco, drinking alcohol, which are some of the top risk factors. And then we have the mental health and some medical conditions. For example, depression, elevated blood pressure, which we call hypertension, high cholesterol, heart arrhythmias, and other medical conditions that cause blood clots. Then we have risk factors that we can't change. For example, race, heredity, our age, our sex. So those are some risk factors that we can't change. And all these are risk factors that lead to heart disease.
Thank you so much. I mean, we talk about these things all the time, but we also sometimes vicariously don't think about how it affects us personally. So what are the causes of heart disease or contributing factors? I know that you mentioned a few, but if you can just elaborate more on that.
So heart disease is caused by multiple types of heart conditions. For example, the most common heart condition is coronary artery disease. This is like a buildup of plaque in the arteries. And our arteries, they carry oxygen, nutrients away from the heart into our body's tissues and organs. So our arteries perfuse our bodies. So the risk factors that I discussed previously, they contribute to fatty plaque buildup, which in turn results to heart disease. But some of the other heart diseases that people are familiar with is hypertension, like I said, hyperlipidemia, which is high cholesterol, congested heart failure, diabetes can contribute to heart disease. So there are a lot of conditions that can cause heart disease.
Wow, wow. Do you hear that, everybody? I need everyone to really think about what Dr. Kaysen is saying and the contributing factors. Your diabetes can lead to heart disease. Your high blood pressure can lead to heart disease. So it's so important that we keep these in mind when we are going to visit our doctor and taking the advice that they're actually giving us very seriously. Another question, we have several questions for you today. What should we do to prevent heart disease or other related illnesses?
Methods to prevent heart disease and other related illnesses. This involves cooking and eating healthy foods. Healthy foods, they're key to our overall good health. And it's important to include fruits and vegetables into your daily diet. And the goal is to stick to a low saturated fat diet, high in fiber, low in fatty processed foods. This includes eating at fast food restaurants, Burger King, KFC, Taco Bell. So be mindful when you decide to eat out and try to pick healthier choices.
And
Exercising. I'm sorry, go ahead.
no, I was gonna say, yeah, that's a good point. And also folks that I talk with all the time always say I don't put salt on my food. And it's not always the salt that you put on your food, it's actually the sodium that's in your food. So reading those labels when they're cooking at home is good too.
That's a good point. Sometimes we're not aware of how they cook the food when we go to these different restaurants too.
Right.
So as my mother says, is you have to learn how to cook and cook at home.
That's right. That's right.
So, and also to take in consideration your finances too. Sometimes it can be a little cheaper to cook at home. So
Right.
that's a good quality to have.
It
Another thing is,
is. It
yes, it
is.
is.
Cooking at home is like a hard task in today's society. It takes planning,
Mhm.
and then you have other people in your house that might not. If you live by yourself, it might be a little different. But when you have to please other people in your home as far as what they like to eat, that healthy eating can become a challenge. But I think that the more that we talk about it on these shows like this and continually make it something like a thing,
Mhm.
um, we can do this. Eating at home is so much cheaper than eating out. Like I remember just looking over my budget recently and looked at my just expenses to see what I actually spent eating out. And it hurt I was so hurt. I was so disappointed in myself. I said, we have to do better. Just if I spent $50 just to make something simple at home to feed the four of us, that might last for 2 days.
Yeah.
So
And
Yeah.
we have five. I have three children. I have an 8-year-old, a 6-year-old, and a 6-month old, and then my husband and myself. So we have to feed five individuals.
And it's not really easy to just cook a meal because I have 4 small children, and sometimes I don't have time to cook a healthy meal, so I'm kinda, you know, a bad thing. It's the bad thing that I'm doing myself, but it's sometimes you don't have time to cook a meal, and you just go eat a pizza, go eat a Lunchable or something real quick because, so it is really hard. So
yeah, but it is difficult, but we have to just be able to create the just spaces or just programs where we can do better with our eating. Everyone doesn't have a budget to go and do the Hello Fresh.
Right.
Um, so we have to become more creative about how we're eating. But it is so important because we don't want to get a diagnosis of diabetes or high blood pressure or cholesterol and ignore it because the piece that we can't get right is our eating habits.
Yeah.
So we're actually going to be addressing some of that in the months to come as far as exercise and better eating in lieu of our program that we will have with Chef Brown. Another plug for
Yeah.
her
I
as
was
the
about
end
to
of
say,
this
I
month.
think I'll benefit from that because I can probably put my food in the crock pot in the morning and it'll be done by the time the kids get home from school. So I'm interested in learning what she has to tell us.
But go ahead, Dr. Kasem. This is just
Sorry.
conversational, so go ahead. This
Oh,
is
Sorry.
I love it. It's great. We can relate to so many people out there in the community. So I think this is
Mhm,
great.
mhm,
Another topic is exercising.
mhm,
Exercising, it helps to maintain a healthy weight. It decreases blood pressure, cholesterol, and helps with your blood sugar. So I recommend walking, swimming, biking, cardio activities at your local gym or the Y. I take my children to the Y, and sometimes I work out at our local Y.
mhm,
The Center for Disease Control and Prevention, the CDC, they recommend 2 hours and a half a week, which helps with heart
mhm.
disease. So, ideally, exercising 30 minutes, 3 to 4 times a week is a great idea and helps with heart disease.
Yeah.
Yeah, we know it's cold outside, but we're out there. So
Yeah.
I know that along with what you were just saying, sometimes I park a little further back in the supermarket or wherever I'm going and just say, well, let me get my cardio in and just walk to the
Yeah.
door. Or those of you that have pets,
Mhm.
you walking your dog, take your kids with you, or um, walking up and down your steps, or even just outside up and down your block. It all counts. So I know Michelle had some questions too. Go ahead, Michelle.
So we know that it's a fact that you may not have any signs with heart health. It could be no signs. But what are the early signs?
So, I think it's a good idea to focus on two things. You have your strokes and you have your heart attacks. So for strokes, you may have a severe headache with no known cause. I'm not talking about your typical migraine. You have a severe headache and you don't have any known cause, and some of the over-the-counter medications they may not be helping. That could be a sign. Issues with your balance, loss of balance and trouble walking, weakness to one side of your body. If you can't pick up a cup or pick up a book or hold your phone, that could be a sign. Or looking at
Mhm.
your family member's face and seeing that their face is kind of lopsided and they have like a what we call a facial droop. That shows
Mhm.
weakness to one side of the face. Sometimes you have vision changes, confusion, trouble understanding, trouble talking. So those are signs of early signs of stroke. Now, for heart attack, you may present with that chest pain, difficulty breathing, feeling nauseous, sweating. Sometimes that pain may radiate to your jaw or to your arm. So
Mhm.
those are some of the common early signs for heart disease, heart attacks, and strokes.
Yeah, that's interesting that you say that because in 2009 I was New Year's Eve. I had a headache and it wasn't like a normal headache. Like you said, it's not your typical normal headache. It just would not go away. And I went to the emergency room and my blood pressure was 171 over 108. And that's when I found out I was hypertensive. So you're right. That headache is way different from the one you say, I'm going to just take a nap. Hopefully I wake up and be okay. Yeah, so definitely have to keep an eye out for those headaches.
And
Um,
thank you for sharing about your blood pressure because a lot of people, it's called a silent killer. Some people walk around here with blood pressures 200 over 100, and that's
yeah,
life threatening. The higher your blood pressure is, the increased risk of a stroke.
yep, yep, absolutely. And talking about highest, who is highest at risk? Who has the highest risk?
Based on statistics, African Americans are at the highest risk. Research states that African Americans, they have this gene that determines how much cholesterol your body makes. And then heart disease is a leading cause for women in the United States. And then it's common with men older than the age of 45. And
Wow.
also women, that's menopause.
Hmm.
Wow, I'm there with that. But I think that we need to normalize taking our blood pressure. Michelle and I had this conversation this week,
Hmm.
and we both agreed. I have two blood pressure cuffs at my house because I deal with high blood pressure, and I'm on high blood pressure medicine. But we need to normalize taking our blood pressure because that's kind of, as you said, like a silent killer. It's sneaky. You know,
Yeah.
you don't know what might trigger it, what food we might eat, or lack of drinking water that might trigger our blood pressure to fluctuate. So I think that just what you said right there, and even with menopause, I've just reached that plateau. And let me tell you something, it is not a happy trip. However, just being mindful that we just need to normalize some of these simple fixes, taking
Mhm.
your blood pressure, making sure we're drinking enough water,
Yeah, and
making
that's
sure.
included. That's
Mhm.
included with getting your physical exams every year, getting your blood pressure checked.
How about that?
I will give you an example. I've seen some patients that come in the emergency room and they're so anxious and stressed out about their blood pressure, and they say, "I checked my blood pressure 5 times today, and it was elevated. Each time I check it is different and it's higher." I recommend checking your blood pressure maybe once or twice, maybe once in the morning, once at night, because when you start to get stressed or anxious, that causes the blood pressure to go up. And it can
Mhm.
fluctuate if you keep checking it over and over again. So I think that is a good practice to check your blood pressure yourself and just keep track of it and take that piece of paper with your blood pressure readings over that week to your primary care doctor, because that
Mhm.
will help them to determine the effective treatment and what medications you should be on and if the
Mhm.
medication is actually working.
Right.
Such a good point. Such a good
Mhm.
point. Thank you.
And I know taking your blood pressure can't, is that the only test that you can do, to detect early heart disease? Is it just
Well, there's so many tests. I'll talk about a few of them. The common one is EKG. It
Mhm.
measures the electrical signal of the heart, and this checks for heart disease. This is the first test that we typically do in the emergency when you present with chest pain. We put
Mhm.
leads on your chest, and it's connected to a monitor, and then we can look at that electrical rhythm to determine if you're having a heart arrhythmia, or if you have a heart attack, or if you have heart disease. And then there's different type of blood work that can check for heart damage, like your cardiac enzymes, and then we can check your cholesterol, your good cholesterol, your bad cholesterol, your triglycerides.
Mm.
Another common one is a cardiac catheterization. It's a thin tube that's inserted into a blood vessel in your leg or your arm, and it moves all the way into your heart and it looks for blockages. Um, Another common one is the chest x-ray. It produces a black and white image that shows your lungs. So we use the chest x-ray to determine, do you have fluid in your lungs? Is your heart enlarged? We just look for any abnormal findings that can help us determine a diagnosis for that particular heart disease or condition.
Wow, and that can all be done through going to your primary care physician. They'll determine whether those tests are necessary. We can't just march in and say, "I need you to give me an
Right.
EKG,"
You
I
can
think
because
it's
I was
cardiac
watching Dr.
catheterization.
Carson and she said, "You need to
Yes,
check this for me."
you definitely can suggest it. You can suggest, I'm having chest pain and I want to have an EKG done. Now, but definitely when you present to your primary care doctor or to the emergency room, we will determine which tests are appropriate for your presenting symptoms in your situation and your history. But it's good to be knowledgeable about these different tests so you know what to look for, and it helps to determine what questions you may want to ask.
Yeah.
Mhm.
It can be intimidating sometimes going into your doctor because we're thinking they know all the answers for us. But how about like even us discussing this right now, we can go in there armed with some information,
Mhm.
you know, because we don't know all the medical terms.
Yeah.
So when we're going into our primary care physician for an appointment, we might not be able to interpret everything that they're giving us. So this information is very helpful. It's very
Mhm.
helpful. We're going to go on to our next question. So, if a woman wants to start a family, what should I know about my heart health and how that will affect my pregnancy?
I think the first thing to really understand that pregnancy alone just changes the heart and blood vessels, and it adds stress onto our bodies, and it causes our heart to work harder. And the reason for this is because we have a baby and we need to be able to provide oxygen and nutrients to the baby. So therefore our body is working harder. Sometimes
Mhm.
your heart rate can increase, your blood pressure can fluctuate. But some women, excuse me, experience complications due to their blood pressure and their blood clots. And then they find out that they have certain heart disease by just being pregnant. They don't know
Yeah.
anything about it prior. And when they become pregnant, when they have their checkups, certain things just pop up. But it's important to make sure that you follow up with your primary care doctor. And when you see your OBGYN, you want to discuss these heart conditions and you want to help to develop a plan or, just schedule like yearly GYN examinations to stay on top of things. But
Mhm.
another important thing that I would like to say is with the advanced maternal age, this is considered over the age of 35. It increases the risk of congenital heart disease. And this is a problem with the baby's heart structure, and it occurs at birth. So just be mindful that your previous conditions can cause issues with your baby. So it's important for your OBGYN to be aware of them.
Mhm.
I
Yeah.
have to say this, and as I was reading this question, I absolutely forgot that when I had my three daughters, each one of them I had preeclampsia.
Yes.
I lost my first baby to preeclampsia back in 1990. I think it was 1998. And I lost my first baby because of the fact that I went from preeclampsia to being eclamptic. And I had to be on bed rest I think the last couple of weeks prior to having that baby,
Yes.
and still lost the baby. And
Sorry.
so each one of my pregnancies was high risk.
Mm.
And for those of you that are out there listening, it wasn't inherited. It wasn't anything that anyone in my family had, but just be aware of taking care of our bodies, because that hypertension, like I had to get all the tests done. My third pregnancy, I was 37, so I had to go through all of the tests that they have for those that are over 35 having a baby. So and it was a really horrible experience. I remember having to take my blood pressure was constantly high. It was constantly
Mhm.
high. So do you see a lot of those cases in your practice as well?
I do see those. They typically present to the emergency rooms so we can medically stabilize them, and then we can send them to the labor and delivery unit to be evaluated by the OBGYN. But you bring up a good point with this advanced maternal age because myself, I have a 6 month old, and I was 35 when I got pregnant. I was considered high risk. So I don't like to discourage women from not having children after the age of 35 because there's so many women out there that have normal, healthy pregnancies,
Mhm.
and they're over the age of 35. But it's just important to take those precautions to prevent any complications.
Yeah. Yeah.
I would just, as you said, I wouldn't discourage anyone from having a baby, but to find out your history, your family history, um,
Mhm.
prior to getting pregnant, or while you're pregnant.
Right. Well, that kind of answers the next question I was going to ask. What is the best advice you can give a woman seeking more information on how to prevent or see the warning signs or get help? I don't know if you had anything else to add to that.
Well, I would like to add one thing. I feel, well, maybe two things I kind of feel passionate about. As I said, reading, education, being aware. Reading is powerful. I
Mhm.
recommend reading the CDC, going to the website, the CDC, the American Heart Association website, because it's helpful. And I love research. I love statistics. I think that we all just need to be aware of our family history and the risk factors. And
Right.
especially with women, see a healthcare professional if you develop any unusual symptoms because women don't always present with that classic stabbing chest pain. Some of them are
Mhm.
just fatigued and tired
Mhm.
and end up having a heart attack. And then, of course, the mental health. If you have a history of depression, stress, anything of that nature, reach out, talk to a therapist, a counselor. Take time to do things that make you happy, things that you like, because stress, depression can lead to heart attacks and heart disease.
Mm.
Right.
Yep.
Absolutely.
That's a great tidbit to add there. And I'm hoping that our listeners are taking this information in, that while we're presenting this, you can reach out, do something about it. Don't just suffer in
Mhm.
silence. Please don't do that.
Mm-hmm.
And so, even for our next topic, we're talking about heart health, but now we're going to switch it over to a similar disease, cardiovascular disease. And what is cardiovascular disease for those that don't know the difference between the two?
Well, cardiovascular disease, the thing about it is it's a condition that typically affects the heart and the blood vessels. So again, there are numerous conditions.
Mm-hmm.
Cardiovascular disease is just broad, and it's other things that fit under cardiovascular disease. But overall, it's associated with the buildup of the plaque in those arteries that cause them to be narrow, and it
Mm-hmm.
affects the blood flow to our vital organs or our tissues, to our brain, to our kidneys. So that's pretty much what cardiovascular disease is.
Mm-hmm.
And so, as a nurse practitioner working in the ER, what is the rate of patients you see that don't have a primary care physician? I think we talked about this, but we are going to continue to talk about this.
You know what? This is a difficult question for me because I've worked in and I currently work in different emergency rooms with different patient populations. So it's kind of hard to answer that. In certain areas, I work in a patient population where they don't have primary care doctors. It's more of um, a disadvantaged area where they don't have access to grocery stores with healthy foods or have community resources and programs. Some of them don't even understand the process of reaching out to the emergency medical system in that particular area.
Mhm.
So it really varies. But I see patients with insurance. I see patients without insurance. I see anybody that walks through the doors. So to give you an accurate number right now, I don't have that.
Mhm.
But just so you know, it is common that I see people without primary care doctors. And one of my roles and responsibilities is to provide those resources. So when
Mm-hmm.
they're discharged, they can follow up with someone to continue and do further management of their care.
That's
So
good.
you hear that? You hear that? You hear that, listeners? Even if you do not have a primary care physician and you're listening to us now, reach out to Harford County Health Department and on our webpage and research the information so we can help you get connected with a primary care physician. And we know that, especially Edgewood, unfortunately, we have too many food deserts here. So we have to be creative about our health, and we have to be creative about how we stay healthy in regards to eating. So
Mm-hmm.
that's another thing that Minority Health is trying to work on with some of our minority leaders, just to bring better food to our area in
Mm-hmm.
general. So thank you so much, Dr. Carson, for that tidbit of information. Um, Michelle, I know you had another question as well.
Uh, well, I can ask the next question. What should our community be aware of in regards to cardiovascular health?
I would say just making sure that individuals in the community are knowledgeable about all of the risk factors that we talked about, the public educational programs, especially the youth, having programs for our youth to be aware of it, because then we can be proactive versus reactive. We can start them at a younger age with these community resources, having areas to play basketball and safe areas to run and play and enjoy themselves as a child. And just educating our community on access to emergency medical care system, knowing how to get in contact with someone if in need of an emergency.
Mhm.
Absolutely. And I'm so glad that you brought our health. We are um, putting this announcement out ahead of our official announcement, but we are partnering with the Boys and Girls Club of Harford and Cecil counties. We are partnering with the Harford Community College and other local churches and organizations to address the mental health issues that our young people face. So stay tuned for that. All of our listeners, stay tuned because we want to take the bull by the horns and address it on a level that they can relate to. So it's not going to be us adults just sitting back, pointing our finger, helping them. It's going to be our young people. So please stay tuned for that. And next, we have just some fun little topics to just address, and we just want you to answer myth or fact.
Okay.
So this segment is going to be myth or fact. And Michelle, I guess I'll ask first, and you can go next, or we can bounce it back and forth. Okay.
Okay.
Does heart disease, um, does heart disease and heart attacks only affect the elderly?
That's a myth.
That's a myth. Okay, Michelle.
The belief that I can reverse the effects of heart health issues by just eating fruits and vegetables.
That's a myth.
That's a myth.
That's a myth.
Okay, heart disease is the same for men and women.
That's definitely a myth.
Okay. If you have a family history of heart disease, there really isn't anything you can do.
That's a myth. There's a lot of things that you can do, even if you have a family history of heart disease.
Okay.
That's great to know. You should avoid exercise if you have heart disease because you might have a heart attack.
Typically, that's a myth. You want to exercise, but you don't want to overexert yourself because in certain situations and certain conditions, if you have a medical history of cardiovascular disease that's severe, it's certain exercises you can't do.
Mhm. Right. You should always seek medical advice before doing anything anyway. So
Yeah, absolutely. So we got one more. It says, so heart disease is colorblind.
That's a myth.
Heart disease is not colorblind. Anybody can have
anybody.
heart disease. Anybody.
Yep.
So that kind of wraps up our segment. And Dr. Kaysen, thank you so much for spending part of your evening with us and talking about this very important talk about heart health. We hope to have you back on again. And for our listeners, was there anything else that you wanted to add that we didn't include, or any other pertinent information that you would like to our listeners to know?
The only thing I'd like to add is just talking to you ladies. It seems like you're doing some great work out there in the community, and you're coming up with some, some imperative and critical programs that will help the community. So definitely impressed with everything you guys are doing, and just want to thank you for inviting me today.
Thank you.
Well, thank you. Thank you for joining us.
Yes.
And that wraps up our Let's Talk About It for today. Listen, make sure that you look at our webpage, participate and register for our Crockpot event, which we are very excited about. I did forget to mention that if you are already pre-registered, that you will be invited to join us and sample some of the recipes that Dr. Catherine is going to make. We still have space and we still have time. It will be, she'll be going to cook live at the Village of Lakeview and the Community Rec Center. So please register. The link will be provided to you, and we'll let you know what time to get there so you can test it. But we're also going to have this live as well. So thank you so much, and
Yes, thank
we
you.
will see you next time.
Bye-bye.